Anorexia nervosa is a type of eating disorder which can be found in individuals across all age groups. Here are some of the causes, some symptoms, and some treatments of the disorder.
Hello, Beta. I've seen you. You're the one who goes jogging every morning, no? This is my daughter. We bought her jeans last month, but now she says they're too tight. Why don't you take her jogging every once in a while? Make her slimmer, thinner like you?
Some people with anorexia may have obsessive compulsive personality traits that make it easier to stick to strict diets and forego food despite being hungry. They may have an extreme drive for perfectionism, which causes them to think they're never thin enough. Although it's not yet clear which genes are involved, there may be genetic changes that make some people at higher risk of developing anorexia. Some people may have a genetic tendency towards perfectionism, sensitivity, and perseverance, which are all traits associated with the eating disorder.
Oh, I got you your favorite snacks from the grocery store. Here. Oh, thank you. That was so sweet of you, but I don't eat these anymore. So you can have some back. Why don't you want to eat these? Aren't these your favorite? Wait, where are you going? What was that? Anorexia nervosa is a kind of eating disorder which is characterized by compulsive behavior, binge eating, hyperactivity, impulsivity, and social isolation. People who are suffering from such an eating disorder experience dehydration, dizziness, fatigue, fainting, low blood pressure, and low body temperature. So, the next time you notice someone suffering from such symptoms, don't forget to seek professional help.
Hello everybody. In today's online therapy session, we will talk about the treatment of eating disorder, anorexia nervosa. You can seek help from a primary doctor who will provide you with medical care. A psychologist like me will develop the behavioral strategies and help you return to the normal healthy weight. A dietitian will offer guidance on the regular patterns of eating along with the specific meal patterns and proper nutrition requirements. In the end, it is your own willpower that will help you overpower this disorder.
If you are schizophrenic, your feelings may become less intense. You can also lose your body's motion sense. It generally occurs when you're in your mid-20s and hallucinations are common as well. Is that why I heard that picture talking and there's a voice in my head that I can hear me mocking? Why are you looking at the door? There is no one there. But I can clearly hear that someone's knocking. Hallucinations show that you are schizophrenic. Did by any chance any of your parents have it? My mom had it when she was 25. That's why you have it too, because it's genetic. Since your mom has schizophrenia and so do you, there's a 12% chance that your child will too. And if you marry someone with the same disease, from 12 to 40, the chances increase. It can also be triggered by a major stressor and your dopamine levels need to become lesser. These neurotransmitters are very crucial. Antipsychotic drugs will make you better. The complete causes and treatments are yet to know, but taking antipsychotics is the way to go.
Schizophrenia literally means split mind. It's a chronic and severe syndrome including three main categories of symptoms, namely positive, negative, and psychomotor symptoms. Positive symptoms show bizarre additions to a person's normal behavior. It primarily includes delusions and hallucination. Hallucination refers to perception formed by a person over things that do not exist. For example, a person may hear inanimate objects speaking around them. Delusions are firmly held beliefs that are untrue, such as believing that they are spied upon. Negative symptoms include loss of motivation and difficulty in finding pleasure, followed by diminished or no emotional expression known as avolition. They also show alogia or poverty in speech. Psychomotor symptoms include odd behavior which may take extreme forms as catatonia, which involves staying motionless for long or persistent awkward posture.
researchers are not sure of the exact cause of anxiety, but some of the causes for anxiety disorder are stress at work, stress from school, stress in a personal relationship such as financial issues, political issues such as marriage, stress from an emotional trauma such as the death of a loved one, stress from a serious illness, side effect of medication, use of an elite drug such as cocaine, symptom of a medical illness such as heart attack, heart stroke. Some researchers suggest anxiety disorder may be linked to faulty circuits in the brain that control fear and emotion. In addition, researchers believe that the areas of the brain responsible for controlling fear may be impacted.
Suddenly, I was losing control over my stressful situation. I would randomly start crying or struggle to answer someone because I was terrified. Thought of deaths were racing constantly in my mind, and then suddenly I had my first panic attack. I felt myself losing. I was unable to cope. I didn't know that I was having panic attack at the time. All I remember is feeling like I was gonna die. These are some common symptoms for anxiety disorder. Some more common symptoms are hypervigilance, irritability, restlessness, lack of concentration, sweating, fear, insomnia, palpitations, trembling, and many more. So the next time you experience such symptoms or see someone else experiencing such symptoms, know that it has something to do with anxiety or some other mental disorder.
After experiencing the symptoms of anxiety, I was taught different techniques and ways to cope with anxiety. What was happening to me? I learned about self-care like avoid alcohol, reduce caffeine, healthy diet, breathing techniques, visualization, relaxation technique, therapies like cognitive behavior therapy, psychotherapy, counseling and medication. And power of accepting that you are experiencing anxiety and that's totally okay. It is going to go away eventually. So, anxiety disorder can be successfully treated and untreated anxiety or disorders can have serious effect on personal life and relationships. Thank you.
Hello everyone, I'll share with you some of the causes of bipolar disorder. Firstly, levels of high stress such as death of a loved one or any other traumatic event. Secondly, genetics can also be a cause for bipolar disorder, as if your parent or sibling have suffered from bipolar disorder, there are chances that you can also suffer from it. Thirdly, drug or alcohol abuse can also be a cause, as alcohol increases the intensity of mania.
Hello everyone. Today I am going to tell you the symptoms involved in bipolar disorder and what a person suffering from bipolar disorder experiences. Mood. Mood swings, sadness, elevated mood, anger, anxiety, apathy, apprehension, euphoria, etc. Behavioral. Irritability, risk-taking behaviors, aggression, disorganized behavior, agitation, crying, hyperactivity, impulsivity, etc. Cognitive, unwanted thoughts, delusion, lack of concentration, racing thoughts, slowness in activity, or false belief of superiority. Psychological, depression, manic episode, agitated depression or paranoia. Weight loss or weight gain. Sleep, difficulty falling asleep or excess sleepiness. Also common, fatigue or rapid and frenzied
Hello everyone. I am going to tell you the therapy involved to treat a patient suffering from bipolar disorder. Cognitive behavioral therapy. The focus is identifying unhealthy, negative beliefs and behaviors and replacing them with healthy and positive ones. Cognitive behavioral therapy can help identify what triggers your bipolar episodes. You also learn effective strategies to manage stress and to cope with upsetting situations.
Attention Deficit Hyperactivity Disorder (ADHD) is a neurobiologic condition whose symptoms are also dependent on child's environment. Research to date has shown ADHD may be caused by a number of factors. First, brain anatomy and function. A lower level of activity in the parts of the brain that control attention and activity level may be associated with ADHD. Second, genes and heredity. ADHD frequently runs in families. A child with ADHD has 1 in 4 chance of having a parent with ADHD. Significant head injuries may cause ADHD in some cases. Prematurity increases the risk of developing ADHD. Prenatal exposure such as alcohol or nicotine from smoking increase the risk of developing ADHD.
The symptoms of ADHD are first, inattention, that is, disorganization, lack of focus, difficulty giving attention to details, and have trouble staying on topic while talking. Second, hyperactivity, that is, fidget and scum when seated, get up frequently to walk or run around, have trouble playing quietly or doing quiet hobbies. Third, that is impulsivity, impatience, having a hard time waiting to talk or react, blurt out answers before someone finishes them asking a question. Thank you.
When a child is diagnosed with ADHD, parents often have concerns about which treatment is right for the child. To find the best treatment options, it is recommended that parents work closely with others involved in the child's life, that is, therapists, teachers, coaches, and other family members. Types of treatment for ADHD include first, behavior therapy. It is a treatment option that can help reduce the ADHD symptoms. It is often helpful to start behavior therapy as soon as a diagnosis is made. Second, medications. Medication can help children manage the ADHD symptoms in their everyday life. That's all. Thank you so much.
Obsessive thoughts, that is obsession, that lead to repetitive behaviors called compulsions. These obsession and compulsion interfere with daily activities and cause significant distress. You may try to ignore or stop your obsession, but that only increases your anxiety and distress. Obsessive compulsive disorder is characterized by unreasonable thoughts and fears that lead to compulsive behavior. Disordered beliefs reinforce and maintain symptoms associated with OCD. Here are a few symptoms of the disorder.
Symptoms usually begin gradually and vary throughout life if not treated. People may experience meaningless repetition of own words, repetitive movements, social isolation, fear of germs or dirt, might be scared to touch things other people have touched. Excessive doubt or fear of making a mistake, frequent need of washing or cleaning, you say or do things a set of number of times in a certain way before being able to leave the house. OCD usually doesn't happen at all once. Symptoms start small and to you they can seem to be normal behavior. They can be triggered by a personal crisis, abuse or something negative that affects.
Obsessive compulsive disorders treatment may not result in complete cure, but can help and bring up symptoms under control so that they don't rule your daily life. Cognitive behavioral therapy, a type of psychotherapy, has been effective for many people with OCD. Exposure and response prevention component of cognitive behavioral therapy involves gradually exposing you to a feared object or obsession, such as dirt, and having you ways to resist the urge to conduct your obsessive rituals. Another method can be support groups. Support groups are an important tool for people with OCD, for example, family members and friends. Getting to interact with people impacted with OCD can provide a sense of community and lets you know that you are not alone in this struggle.
Some of the major causes which cause depression are first, life events. According to research, long-term unemployment, an unhealthy relationship, or long-term isolation can cause depression. The personality of a person also plays an important role. If a person has a tendency to worry a lot or has low self-esteem, that person is more likely to suffer from depression. Stress also
depression isn't something in which a person would necessarily cry all the time. There can also be kinds of depression in which the suffering is internal and the person is smiling from the outside. So, no matter what is happening, recognize your symptoms if you have any and don't be afraid to ask for help. There is hope for everyone.
Treatment of depression consists of antidepressants. Three major ways to deal with depression are therapies, medication, and medical procedures. In therapies like cognitive behavioral therapy, a therapist helps you to identify negative or false thoughts and replaces them with healthier and positive thoughts. Behavior therapy uses techniques like relaxation training, systematic desensitization, virtual reality exposure, behavioral rehearsal, and homework and aversion therapy and punishment. Psychotherapy or the talk therapy is used to help the person find ways to deal with everyday stressors. It can also encourage you to use your medication properly. Medication like SSRIs, antidepressants, and anxiolytic are often prescribed by doctors to help us relieve anxiety and tension. They even promote sleep.
Good morning everyone. Myself Siddhi Chaudhary from class 12B Science is here to tell you about the causes of multiple personality disorders. A history of trauma is a key feature of dissociative identity disorders. About 90% of the cases of multiple personality disorders involve some history of abuse. The trauma often involves severe emotional, physical, or sexual abuse. It might also be linked to accidents, natural disasters, and war. An important early loss such as loss of a parent or prolonged periods of isolation due to illness may be a factor in developing multiple personality disorders. Episodes of multiple personality disorders can be triggered by a variety of real and symbolic trauma, including mild events such as being involved in minor traffic accidents, adult illness, or stress. Thank you.
Hello, I'm Kanishka. I'm going to tell you about the treatment for multi-personality disorder, and the treatment is psychodynamic therapy, which is also known as the talking therapy.